however you need to learn or at least accommodate or acclimate to that information, right? And then you say, well, okay, I have so much to cover. I usually see students spend 5 to 7 days per system if they haven't seen it in a while, whether it's videos, notes, or both. And then say, okay, I've done immuno, micro, biochem. Same thing I keep saying, right? Heart, lungs, kidney, all the organ systems. Now, what don't I know? And I can promise you, you'll never be 100% ready, meaning you'll never cover everything. But if you are constantly scoring above average on your QBanks, now QBanks can be Kaplan, UWorld, AMBOSS, Bootcamp. Everyone has a QBank now, right? Be careful because some are as good as other ones, but still. So if your QBanks are doing well, 62, 60% consistently, okay, that's a good sign. Now, are they focused or random, right? Are you doing questions or just focusing on specific topics, or you're mixing everything up? That also makes a difference, right? Either way, above 60, then you say, okay, I need to take an assessment. Please, I've also got a lot of questions asked about this. NBMEs are old ones and new ones. New ones are on the website, USMLE.org, NBME, you could find it. You have to pay for them, all right? I would suggest strongly you can find old ones online. The ones are offline, actually. They're older ones that practice the style of those questions. And then when you feel ready and you're comfortable with the way they're written and the way they're structured, then you invest some money and buy the online one, because the online one will be timed and then scored immediately, okay? And then you take the 120s, like I've said over and over again, and then the actual test. So will you always feel ready? Maybe not. Will you always be able to cover everything? It's impossible. But this is a pass or fail exam. So if you see that the scores are above average, I'll just tell you this. Every one of my doctors that reaches out to me that I work with, especially one-on-one, or doctors like yourselves in these sessions, you reach out to me, like many of you do on office hours and messaging. I'll tell you how I feel, and I'll always ask you your score. So if you're scoring 60% above and you're consistently seeing improvement, then I always give you the green light. But if I see that there's a fluctuation in score, and maybe test taking anxiety, pressure, not feeling well, and realizing that your scores are not consistent, then that's a sign that you have to work more on test taking, okay? That segues into, I'm not sure if you're familiar with prometric test driving, but it is real and it happens often. And I would recommend you guys to do that. Basically, the Prometric Center allows you to test drive their centers for 30 minutes. Now, basically, you do this, you walk in, you test drive the actual registration process. You walk in, they check you in, go sit down the computer. The questions are not USMLE at all. They're just generic questions. You're paying for the experience in the test center, on the computer, seeing how things will work when you check into the actual center. It's a good idea to do that because I know many people do fail because the centers were too loud, too noisy, too cold, too hot. I mean, that's what I was told by people who have reached out to me. So I would say if things do bother you, you have control over the content, you have control over the questions, you have control over your health, mental and physical.